Hey, Zion. So, are you a football player?
Yes, sir.
You are? Okay. How'd I guess? How long's this been stuck in there?
So, it been hurting for about a week or two.
I'm just doing a little inspection here on this.
So as I examined Zion's ear, this just isn't your average stuck earring. This is something a little bit more complicated. It might be an early infection even too, because it's a little red, a little swollen.
Before the season started, it wasn't hurting as bad as it is now. But since the season started with my helmet and it just banging on it and banging on it, it was just like, guys, to get it out.
It looks like it's infected. The earlobe is actually significantly swollen, a little bit red, a little inflamed looking. And then behind the earlobe, it's really what we call macerated. It's really kind of torn up. And kind of what I would expect if someone's a football player wearing a helmet, having an earring in place. It's obviously buried in there really deep.
Kind of apply this, it's like a really thick lotion around the top of the earring here.
If Zion had never told his mother about this and didn't come in today and just allowed this earring to stay buried there, the body's going to respond to that. The body's going to try and kick it out itself. And that's going to be an inflammatory reaction. And with inflammatory reactions come secondary infections. When patients come in with a perichondritis, which is a big word meaning that the cartilage is now infected, those are even more complicated problems. So the longer it's in there, there's going to be a very unattractive scar, and that's part of the reason we need to get it out. We need to get it out now.
Does that feel a little bit number now that we put this medicine on there?
Oh, yes, sir.
It does, okay. You see that right, that baby right there? I think it'll poke through nicely.
The worst case scenario would actually having to take a blade to go in there and open up the back, and we've done that on occasion too. The problem is as the earlobe gets more swollen, then it gets harder and harder to find, especially if it's a small earring.
All right, here goes. I'm just gonna see if I can just poke that baby right on through there without causing him too much pain. Here it comes. Here it comes. It's stuck on there, but it's coming in. We're making progress. If I have to stop and re-spray with that cold stuff, I can. But I'm just about there.
And it screws on.
Yeah, so there it is. There it is. We got it. I think I just
Oh, it screws on. Okay, that
Yeah.
helps. Yeah.
it's coming.
There we go.
That baby was buried in there. You know, these football players, they don't feel any pain. They just. Okay, so I got it out. All right, so let me see if I can just lefty loosey, righty tighty, right? Mm-hmm. This is like bent a little bit.
The backing of this earring is a screw-on type earring, and I can't unscrew it because the stem is bent. And obviously I can't pull it out the front, and I can't pull it out the back. So I need to figure out what to do next.
We might have to cut it.
Yeah. Would you be upset if I just cut this off?
Talking about the earring?
Yeah.
No.
Okay, good enough. All right, let me go grab some tools here.
My next choice is to cut it off. I don't necessarily have a lot of tools for that sort of thing, but I've learned over the years that a good side cutter, a good wire cutter comes invaluable sometimes in the emergency department.
I'm gonna do the freezy spray one more time, because I want to minimize the discomfort here, but let me know if it bothers you, so. Okay. Got it. Came out.
You know, I hated to think I might have been beaten by an earring, but we got it. I love victories like this, and, you know, it was a little bit concerning that we weren't going to be able to easily get this off.
Here's the earring.
And, you know, obviously, I don't want to consult any of my specialty colleagues. I need to do this myself, but we were successful here.
Unfortunately, I had to cut it. I mean, if you had decided, look, hey, I'm gonna do a nose piercing instead of my ear, you could have reused it, but, you know, I guess we're out of luck now.
I think he's done with it.
Yeah.
So I've been seeing Trish since about last fall, and as a result of some misspent youth, she had a really bad situation with her nose. She had scarring, and there was a very large septal perforation that was crusting, and she couldn't breathe through her nose at all. And we did a sinus surgery. She's a lot better, but I don't know if she's ever gonna be able to have a completely normal nose. What we were able to do is kind of reduce the turbinate size, open things up, and I think you did great after that.
Yeah.
And then we had a little bit of 2 steps backwards with a little bit of an infection. Right now, I think what we're dealing with is just a little bit of crusting.
Yes.
We'll kind of just clean things out so you can breathe a little better.
Okay.
I think one of the most important things just to feel well is to be able to breathe through your nose. And if you snort drugs into your nose, it shrinks the blood vessels. And the cartilage, which is in the middle of the nose, doesn't have any blood supply. And when you take that blood supply away, the cartilage can die and you end up with a huge crusty hole in your nose, and it can be quite serious. Looking inside, you can see there's kind of discolored mucus and scabs and crusting. What you're seeing with Trish is about one of the worst noses that you're gonna see. It's so damaged from previous infections. I mean, she has basically crusted from one side to the other. So there's some crusts in here that we'll clean out. They kind of just get stuck because of the membrane's a little bit raw. You know, like some people have to get their ears cleaned with earwax. You know, her nose gets clogged with dried up mucus and crusts. All right, just tell me this is uncomfortable. We're not gonna numb this up because it's really just kind of loose scabs that are in here. I don't know if you'll like ever be completely rid of this. We'll get you on a schedule to sort of clean things out intermittently. In cleaning her nose out, what we're finding in there is just a combination of scabs and mucus and bacterial sort of colonization. It just turns into sort of this rubber cement glue in there. If you take that out in one piece, it will literally bounce. You can be holding it and it will be like doing, you know? And it's so satisfying to get that out. So this right here is the septum, and there's supposed to be a wall here, and this is just all open. You've lost, I don't know, 80% or more of your septum. One last little scab here. I think her prognosis is actually quite good with regard to function, breathing, and her ability to smell and those types of things. But just her way back when remote history of intranasal drug use, it destroyed her nose. And, you know, that's something you end up having to live with forever, unfortunately.